Do you feel that being a leader in a large tertiary care center and a small community hospital require the same characteristics, different characteristics, or a blend of both?
So I've been really blessed to have experience in small systems and large systems. And I think that there are some distinct differences between a smaller community hospital system and a large multi-hospital, multi-billion-dollar integrated health system. But I think that fundamentally it's about structure and process and vision. It starts with the vision, and I think all these things are scalable, is what I really should say at the outset. So whether you are trying to address patient flow, if it's at a 1,000-bed hospital, the reason why you're addressing it is guided by the vision. And if the vision is to provide an excellent patient experience, for example, then you got to look at the things that you measure that give you indications as to whether or not things are running efficiently and effectively, patients are safe and well cared for. Flow is a good example. So if you're looking at patient flow at a 1,000-bed hospital, you're going to examine data based on the current flow. You're going to seek to examine the process that guides decisions that allow patients to flow through the system across departments and so forth. And you're going to want to appreciate the structure surrounding patient care that facilitates or influences the decisions and the steps and the measures and all of that. I think it's scalable. I think they're fundamentally the same issues. So whether you use a particular PI approach, performance improvement approach, at a large hospital, the same thinking and approach will benefit a small hospital. There may be fewer steps, there may be fewer departments, but the mentality and framework is just the same. You start with your vision. What are you trying to achieve? And based on that, you prioritize things that are important that will lead to a certain experience for your patients as articulated in the vision. And you will look at the process that guides patient flow, and you'll look at the structure that supports the process and the people. And you'll measure outcomes that very likely will be the same. You can look at something as specific as stroke care, and the metrics that define evidence-based, best practice, stellar stroke care are the exact same at a 1,000-bed hospital as they are at a community hospital. At a 1,000-bed hospital, you may have all the subspecialists physically present there delivering care. At a community hospital, you may have subspecialists present but through a different medium, maybe telemedicine, for example. But you still measure the same things, you follow the same protocols, and you improve based on the same outcomes that you track. So I believe that the approach to improving process and ultimately the patient experience are framed in the very same way, and the variables and the numbers may differ, but it's a very similar approach.